and even beverages, they contain a lot of phosphorus that creates imbalance in the calcium and phosphorus. Jogging is not allowed,
Okay.
but brisk walk they can give.
Okay. Sir's biceps are also visible here. Can you just tell everybody here about your exercise regime? Sir is 69-year-old. Sir, yoga is something that a lot of gym goers don't want to do because they think gym is enough. So, do you have any of these comorbidities with such an exercise regime? Hi, I'm Dr. Aditi, and welcome to my podcast, Talk Tonic, India's leading channel for health and medical fitness. Every episode, we try to get you crucial information from leading experts in every field. So, in today's episode, also, we have got you an orthopedic surgeon, Dr. Kanaji, who will be telling us vital information which will be useful for daily lives for the Indian public. So, stay tuned. Welcome, Dr. Kanaji. Thank you for being on our podcast.
Thanks, Dr. Aditi, for the invitation.
So, people in India commonly think that bone deterioration is generally for the elderly population. They think that such things usually happen when you grow old. That time you have to take care of your bones. Can you please tell the audience the truth about bone health?
Interesting question. Nowadays, even adolescents and adults, their daily life living style, their diet, everything is changing. Their posture is also changing. Now, as far as diet is concerned, people are more prone for coffee and cold drinks and so many junk foods which are having lot of preservatives. Mainly, there will be deficiency in calcium in the food because they are diverted to cold drinks and all those things, which allows them to avoid these protein and calcium rich foods like milk and milk products. And secondly, their posture is not well maintained during their activities. Because of that, they are losing a lot of muscular strength, and lack of daily activities, physical activities, is also causing a lot of problems to the young adults who are supposed to increase their daily muscle strength and bone strength. Processed foods and even beverages, they contain a lot of phosphorus that creates imbalance in the calcium and phosphorus ratio, and also acid base balance. In turn, it interferes with the absorption of the calcium and excessive excretion of the calcium.
So, what Sir is trying to say is that all the processed food items and beverages contain high amounts of sodium phosphorus, which lead to an acid base imbalance in the blood, and this hampers the calcium absorption of the bone. The bone is not able to absorb the calcium from the blood well enough, which is hampering the bone growth. So, my next question to you, sir, is that for a young adult who is in his 20s or 30s, who has never really had an exercise regime before in life, what kind of exercises should they start off with in their daily lives? And what kind of exercises should somebody who in his 50s or 60s should start off with?
Okay, adolescents and young people should build their muscle strength and build their bone. For that, they need to do exercises which are commonly done through swimming, jogging, and weight bearing exercises like pull ups, push ups, and planks and weightliftings. And this is up to 30 years age.
Okay.
After that, they have to preserve the muscle strength and maintain the flexibility.
Okay.
So for that, they have to do simple exercises like jogging, pull-ups, push-ups, cardios, like they can do on the cardio machines also,
Okay.
if available. Otherwise, native exercises like swimming, jogging, or brisk walking
Okay.
will help them to do the exercises. For elderly, you have to maintain the balance of the body,
Acha.
flexibility of the body, all the and health of the joints. So for that, they have to do yoga, which is common for all ages, plus flexibility of the muscles and maintain the health of the joints and avoid excessive consumption of alcohol and all those things, so that they will maintain the balance, they will not fall.
Okay, okay.
So prevention of the fall is very important in elderly life.
Okay. So for them, what kind of exercises? Jogging, brisk walk?
Jogging is not allowed,
Okay,
but brisk walk they can give.
okay.
Stretching exercises they can do,
All right.
and yoga and all those things.
And what about swimming, sir?
Swimming is good for all ages.
So what sir is trying to say is that when you're a young adult, muscle strength is more important, and when you're an elderly person, balance and flexibility is more important so that you can prevent fractures. Sir, yoga is something that a lot of gym goers don't want to do because they think gym is enough. And people who do yoga feel they don't need to do anything in the gym because yoga in itself is enough. What is your take on that, sir? Should both be done or is one enough?
So for building the muscles, you have to go for the gym and do resistance exercises.
Is it necessary to go to the
Yeah.
gym? Can you
Yeah.
not do it at home?
At home you can do.
With what, sir? Like
Indian exercises like pull-up, push-ups,
okay,
and you can say Surya Namaskar.
okay.
These are all very good exercises.
For muscle building.
Yeah, for
Okay.
muscle building. And you need to go for yoga also, so that you maintain the joint mobility and balancing your body, so that you can stand on one leg, put on your pants and all those things.
Okay,
So
okay.
that is very important.
All right,
Because
understood.
we had seen many people falling while wearing the pants.
Okay,
So that is an imbalance. So that has to be counteracted.
okay, understood. So you mentioned posture being very important for bone health. Now in today's generation, posture is a huge problem that is creating lower backache very commonly in young adults. Almost every young adult will have some or the other back issue, and that somewhere or the other is because of bad posture, because all of us have a sedentary lifestyle. At work, most of us are just sitting, nobody's like roaming around and doing work. What do you mean by bad posture, sir? Sir, if I'm sitting here right now with my iPad or I'm on my phone, then is this a bad posture?
Yeah, nowadays we have got lot of gadgets which makes us to bend down and look into it for hours together. That leads to lot of muscle problems, spine problems, and in turn it leads to pain in the body.
Okay.
Plus, if on long term use, it leads to joint diseases and
Okay.
spine diseases. Or urban people who are sedentary, they sit like this, and villagers they sit like this,
That's
which is
true.
very, very interesting.
Yes, sir. That's pretty true actually. So the ideal way should be sitting up straight and looking like this. How should
Yeah, one
one?
has to be straight. The computer screen should be at the eye level.
Okay.
Plus, one has to maintain the shoulder to hip ratio in the same level,
Okay.
and neck has to be straight.
Okay.
And continuously sitting is also not good. So one has to get up from the bed, seat at least in a half an hour, and again go back to the same place.
Okay. So if mobile cannot be at the same level as the face,
It
so
should be like this.
so if we are keeping like this,
It should be like this. Don't keep anything on the lap.
nothing on the lap.
No.
Everything like this.
Yes.
Okay. So then you said the neck has to be straight.
Neck has to be straight.
So if
Back
my
is-
mobile is like this, I have to just kind
You
of
have to sit straight like
yeah.
this.
I don't have to bend my
Yeah,
neck.
you
I
should
have to
not bend
keep.
like this.
Okay. All right.
That
Got
is
it.
important.
So my next question to you is that fractures are quite common in the elderly. As you cross 60, the rate of fracture increases, and everybody has seen that in their own family also. Which is that one fracture which is the most detrimental to their lifestyle ahead and can actually lead to a downhill course for the future?
There are usually two fractures which leads to very poor lifestyle after the fracture, or they become bedridden. Number one is spine fractures, which totally changes the uh, social life.
But these spine fractures must be occurring only with accident, right, sir?
No, they if they fall,
Ah,
even spine fractures occur, like
okay.
dorsolateral spine fractures.
All
They
right.
do occur.
Okay.
And the most common fractures we come across in elderly people, especially in women, are fractures around the hip.
Hip joint fractures.
There is one saying in the books that a man comes through the pelvis and goes through the hip.
Okay.
So it is a very dangerous fracture.
Hmm.
Their lifestyle is totally changed after these fractures.
Okay.
So we have to avoid those things. That can be avoided by maintaining their body balance, exercises, so that the muscles are kept in good tone, and flexibility of the body, so that they can have a lot of movement with their limbs.
So this should be done after how many days of the surgery? If today somebody gets operated for hip fracture or spine fracture, when should they start their exercise regime so that all these things don't happen? Should it start immediately the next day or next week?
Okay, whatever you do, some percentage of patients are not going to improve fully,
Okay.
and exercises will be started as soon as the recovery from the surgery, or
From
when
anesthesia.
the pain relieved during conservative management, we have to start the exercises.
Okay. All right. Got it. What is the most challenging orthopedic case that you have ever come across in your practice ever?
Usually trauma cases are most challenging
Okay.
because they are not mentioned in the books, that kind of geometry we get in the fractures.
Okay.
They are,
By trauma, sir, means road traffic accidents that usually come up in emergency services, and often these patients are in such a bad shape and irreplaceable, irreparable geometry that it gets very difficult for even orthopedic surgeons to put them back in their original shape because the bones are crushed, the muscles are crushed, and only sir can tell us what kind of case has he seen.
I had met with one case, a young man who sustained motor vehicle accident on the road. He had pelvis fracture, both the thigh bone fractures, both the leg bone fractures, both the arm bone fractures, which was who was coming with a lot of shock. So we have to maintain his shock, come out of his shock, and fluid therapy we have given.
By shock, sir, means when the BP suddenly drops because of multiple injuries to the body and there's extreme amounts of blood loss, it leads to a kind of circulatory shock to the body where the BP drops a lot.
The most bleeding fracture is a pelvis fracture. First
Okay.
we have treated that one, then we have treated with thigh fractures, then we have treated with the leg fractures, and lastly we have treated arm fractures.
Okay, so did he
So
survive?
we have to come up with 3 teams of surgeons to operate that person.
Okay.
So to avoid these kind of injuries, try to drive safely with a helmet on, so that he will be safe and doctors will not be troubled unnecessarily in the midnight.
Was this guy wearing a helmet or was he not?
He was not wearing the helmet, so
Okay.
fortunately he did not have head
Okay,
injury.
and where did this take place, sir? Which area?
It's a highway,
Sign in Mumbai.
Mumbai Pune highway.
On the Mumbai-Pune
Yeah.
highway, all right. So what sir means to say is that because the pelvic fractures bleed profusely and maximum amongst all the other fractures, because there are largest blood vessels present around the pelvis, they had to first treat the pelvic fractures and then all the other fractures. Sir, a lot of my cameramen were asking that sir's biceps are also visible here. Can you just tell everybody here about your exercise regime? Sir is 69-year-old and has a fabulous, fascinating exercise regime that puts me at shame at the age of 32. So please, can you?
Okay. My daily routine is I get up at 5 in the morning and go for my routine exercises. Start with the pull-ups and push-ups. take rounds in between walking, and again do pull-ups and push-ups, and again round, and again do pull-ups and push-ups, so that my body doesn't get tired of any one kind of exercise.
So how many push-ups and pull-ups?
Then I do around 100 pull-ups and 100 push-ups,
Okay.
and around 120 sit-ups.
And so you're taking a walk also in the
And
middle.
yeah,
How
in
many?
between I walk.
How much?
My daily steps are around 13 to 15,000 steps in a day, and I swim for around 500 meters in a day, and 1 hour yoga in the afternoon, and I consume my morning lunch at 8 a.m. and I don't take anything till evening, and afternoon I do yoga for 1 hour, and evening also I do little walking. That is my routine along with my practice.
So how do you manage time for exercise?
This is a very good question. If you cannot take time for yourself, you cannot take time for anybody for any work. So you have to manage your time adequately. Do not spend your time on the screen, so that you will utilize the time positively.
So do you have any of these comorbidities with such an exercise regime?
I don't have any comorbidities, and I had COVID during 2020. After that, I have not taken a single painkiller except routine my vitamin D capsules once in a month.
It's absolutely commendable, sir. With that, we end our podcast, sir. Thank you so much for being there today on this channel. A lot of crucial insights for the Indian crowd out there about bone and muscle health. If you think we have shared important information that has added to your life, then please hit the like button, share and subscribe, and hit the bell icon too. Please subscribe to our channel as it's a growing channel and we would love your support. Thank you.
Okay, it's my pleasure. Thank you.